Okay, good evening, and thank you for joining us this evening for tonight's webinar on Game Changer, Optimized Dot and Linear Combination Treatment for Lifting and Tightening the Face with Dr. Rasool Mohamed. First, let me cover a few items of note that will enhance your experience. Second, the system will only allow the presenters to talk. This is to keep background noise out of the discussion tonight. Third, we welcome your questions this evening, so please type them into the comments box. We will cover them at the end of the presentation. This will keep the presenter from covering the same piece of information twice. With that covered, sit back, relax, and enjoy tonight's presentation. Our presenter this evening is Dr. Rasool. Dr. Rasool is Managing Director and Founder of Radiant Clinic and Manera Group, and is member of board certified aesthetic medicine practitioner. Also, the Bachelor of Medicine and Bachelor of Surgery. With the introduction out of the way, let me hand the presentation over to you now, Dr. Rasool.
Hi, good evening, Evan. I can't start my video. The video is stopped. Host has stopped the video, yeah. Can you hear me?
Dr. Rasool, I can hear you.
Can you hear me?
Yeah.
Yeah, but the video is being stopped by the host, so I can't on my video, yeah. Share screen. Share. Slideshow. 1 minute, yeah. Okay. Can you all see the screen?
Yes, I can see.
Okay, so good evening to everyone. I am Dr. Rasool, and I'm the medical director and founder for Radiant Clinic. Okay, so today's topic is going to be HIFU Ultracel Q+, and my topic would be the game changer. Okay, so just imagine this, all right? We are having a patient with us, came for a consultation, and their main concern now is actually for lifting and also tightening. They came with their face sagged and they're asking for treatment. So what do we have to offer is, number one, we can do some form of invasive and another division of non-invasive. So we can start offering them with invasive kind of treatment where we can do for them a thread lift. So we give them an option, why don't you do a thread lift, and you may see a instant result. But now the patient says to you, Doc, I don't want any form of invasive treatment. I don't want threads, I don't want fillers. So what else can you do? So you go to the non-invasive part. So what can we do non-invasive? We have two options. Number one, we can do a radio frequency, or number two, we can do HIFU. So we explain to the patient about both of it, and now they tell you another thing, I don't want any form of downtime, I don't want any form of pain, and the most important, Doc, I got a dinner tonight, I need to look good tonight, I need some instant kind of result. So you have no choice, but you choose one of the best treatment in town is HIFU, and what machine can we use is Ultracel Q+. This one. Okay, I just trying to go to my next slide. Okay, my next slide, we will be dividing into few topics. Number one, introduction of ultrasound and HIFU, and what is the frequency versus depth, the advantages of Ultracel Q+, then we talk about dot versus linear cartridge, the mechanism of action, treatment procedures, and advantages of Ultracel Q+, post-treatment care, and finally, I'll be sharing you guys with my clinical evidences. Introduction of HIFU. Okay, so what is HIFU? Ultrasound is a wave over the frequency of 18 kilohertz and is widely used by our colleagues, our friends who are radiologists, such as they use it for ultrasound device, ultrasound therapy apparatus, and also our physiotherapists uses a lot for as physio device. It has been expanded to aesthetic device market, and the frequency we are using Ultracel Q+ is 2 megahertz, 4 megahertz, and also 7 megahertz. All right, now, the most important thing is it is a non-invasive treatment with thermal effect occurred by focal point made by emitting ultrasound into the skin tissue, which is generated from the transducer. And what are the features we need to know about the HIFU? Number one, it generates enough energy to cause coagulation. Number two, there is no damage to surrounding tissue other than target point. And number three, it is not harmful when passing through human tissue. And there will be no infection or bleeding by non-surgical method. And therefore, it is a very safe treatment with a very, very few side effects. So now when we are talking about Ultracel Q+, then we need to know what is the targeted skin layer. And the most important layer which we should know is the SMAS layer, which is superficial musculoapparatic system. And it is the part which lies between the bottom of the fat layer and also the surface of the muscle. And it is called as muscle layer of facial expression, and this is the layer which causes loose skin wrinkles. And it is located about 4.5 millimeters under the skin, and this is the main targeted area when we do botulinum toxin treatment and also the face lift. So you can see here, the SMAS layer is in between the subcutaneous tissue and also the muscle layer. Okay, now let's talk about frequency versus depth. All right, there are a few kind of frequency. We have spoken just now about 2 megahertz, 4 megahertz, and also 7 megahertz. Let's talk a bit about 7 megahertz. It is a high frequency wave. The higher the frequency, the shorter the wavelength. Therefore, we should know when we are using 7 megahertz, there will be higher absorption, less penetration, and faster rate of heating. So it goes quite fast, therefore it doesn't really penetrate much. So which is the ideal area where we use 7 megahertz is, for example, the forehead. Now that when you come second, the lower the frequency, the lower the wavelength. Therefore, when we are talking about 4 megahertz, for example, there will be a lower absorption, more penetration, and slower rate of heating. And 4 megahertz is widely used for thicker skin, for example, cheeks. And if you're talking about 2 megahertz, that's where we use for the body. So just imagine 7 megahertz, very fast, less penetration, higher absorption. 4 megahertz, slightly slower, therefore they have more penetration and lower absorption. Okay, so what is so great about this Ultracel Q+? What is the advantage of using Ultracel Q+? All right, it is known as the fastest HIFU machine in the world. So we can, and all of us know there is two types of cartridges where you have a linear cartridge and also dot cartridge. So if you are using a linear cartridge, we can complete 300 shots within 3 minutes, which is very, very fast. All right, and if we are using dot cartridge, we can actually complete 300 shots in plus and minus about 8 minutes. All right, then it also has a wider coverage when we use a linear cartridge. Therefore, there is also a property of unique bulk heating. And trust me, there's a very mild or not even much pain or no pain at all. So most of my patients have a bit of mild discomfort, and trust me, I do not use any form of anesthesia or even a numbing cream when I do my treatment with HIFU. All right, what is dot cartridge and what is linear cartridge, and what are the differences? So number one, the difference between dot and linear cartridge. When we talk about dot cartridge, TCP, thermal coagulation period, spacing is adjustable between 1 to 2 millimeters. However, for linear cartridge, TCP spacing is 0. So you have one which can be adjusted 1 to 2 millimeters, and TCP in linear is 0. All right, now this is a comparison between product A, product B, and also Ultracel Q Plus itself between the dot cartridge and also the linear cartridge. So product A, so how do they make this comparison? Number one is with short speed comparison, which is one shot. Test condition, all of them use 4.5 millimeter cartridge, 1.0 joule, and spacing 1.5 millimeters. The time is measured until the motor returns to home after the shot, and testing results may be subject to experimental. Now, just imagine product A. It is proven to complete one shot approximately 2.45 seconds, product B 1.8 seconds, and Ultracel Q Plus, the dot cartridge, 1.5 seconds, and we are using a linear Ultracel Q Plus, which we are using a linear cartridge. It only takes approximately about 0.54 seconds to complete one shot. So you can see the difference: 2.45, 1.8, 1.5, and 0.54, which is very, very fast. Mechanism of action of Ultracel Q Plus. Okay, and this is what we should know. Mechanism and the features. Number one, just imagine a HIFU energy enters at 3.0 millimeter or 4.5 millimeter depth fractionally. And this is the millimeter or depth we use normally around our face area for double chin and also the cheek area. Then focus and energy at 4.5 millimeter depth creates a heat coagulation point as mass layer directly, and that in return causes regeneration of collagen, and elastin results in lifting and continuous skin regeneration. Again, I would just like to remind the features of HIFU Ultracel Q Plus. Number one, there's powerful energy to make coagulative necrosis. No damage to other area except to targeted area. It is harmless once ultrasound passes through your skin tissue, since it's a non-surgical method. Therefore, there's no risk of infection or even bleeding, and it's very safe treatment without any side effect. Okay, this is another comparison between the dot cartridge and also the linear cartridge, and we are using 4.5 millimeter cartridge, and spacing is 1.5 millimeter, and the length we are using is 25 millimeter. And you can see the linear cartridge, the spacing is 0 because their TCP is 0, and energy which is being used by both the cartridge is 0.7 joule. So in dot cartridge, you can see the energy is focused on focal point, and lifting and tightening effect are maximized by collagen denaturation. It takes place here. However, the energy focus more widely, and this reduced treatment time in linear cartridge, and range of denaturation increases by bulk heating and resulting on fat reduction. You can see how much or wider it has covered. And here you can see just a maximized denaturation which is taking place, and there's a focal point, and this one is a wider coverage. Right, treatment procedures. What we should know is about the cartridges for face treatment. So this side, which has 1.5 millimeters, 2.0 millimeters, 3.0 millimeters, and 4.5 millimeters are all the dot cartridges. And where do we use 1.5? We can use for fine wrinkles, we can use for eyebrow lift, and 2.0 we can use for crow's feet, we can use it for periorbital. 3.0, we can use it for skin laxity, pores, and also we can use for neck wrinkles, whereas the 4.5 we widely use for nasolabial fold. And however, the linear has got 3 cartridges, which is 2.0, 3.0, and 4.5. And 2.0 linear cartridge has a unique function where it gives flushing and brightening of the skin. And linear 4.5 cartridge is widely used around the cheek area and also the double chin area. Okay, again, just to summarize, dot type, you have 1.5, 2.0, 3, and 4.5, whereas the linear cartridge has 2.0, 3.0, and 4.50. We are not going to talk much about body, but just to tell you guys, we also have the body cartridge, and both linear and dot gives 6.0, 9.0, 11.0, and also 13.0. And all this is for body treatment. Okay, when we do a face treatment, this is the areas we have to be very careful about, and we have to make sure that we are not on it. All right, so number 1, A, which is supraorbital nerve, B, mandibular nerve, and C, the thyroid cartilage. So these are the areas we have to avoid from doing HIFU. So we have to be a bit careful here. All right, so dot cartridge, again, just to summarize, when we use dot cartridge 4.5 millimeters, normally we use for nasolabial line and also the double chin. 3.0, we can use for skin elasticity, neck wrinkles, and also pores. 2.0, we use eyebrow lifting and also crow's feet area. And dot 1.5 millimeter, we can use for fine wrinkles and also eyebrow lifting. And these are all dot cartridges. All right, so this is for our cheek area and all the stuff. We can use, start with 4.5, we can deliver number of shots, followed by 3.0. Always use the bigger diameter and then followed by the smaller diameter. So most of the time with my treatment, I recommend my patient to take up at least 3 treatments, and I do every 1 month once. And this is quite subjective. There are doctors doing once in 3 months, and there is no right or there's no wrong about it. You just go from the result through your experience and you will appreciate results. And if possible, after the completion of 3rd treatment, we can also ask the patient to do 1 more treatment after 6 months just to maintain the result. So interval between treatment, it could be at least 4 weeks. I do every 4 weeks. And there are doctors who does every 3 months. And I think the most important thing matters is actually the result. All right, how about dot? For periorbital and eyebrow, we can use 3.0 followed by 2.0. And dot for forehead, I normally use 3.0 followed by 1.5. And in certain patient, I also use just 2.0. All right, so again, when you keep on doing, when we see the result, we learn from our experience. Therefore, this is just a protocol, but all based on what you do and what you see. Okay, for nasolabial, using a dot cartridges, we can use 4.5 millimeters cartridge and followed by 3.0. And for neck and mandibular, we can use 4.5 followed by 3.0. All right, how about linear cartridge? 3.0, we can use it for saggy cheek nasolabial lines, and also the linear 4.5, it's widely used for double chin fat removal. And 2.0, as I told you, there's a special feature of it where it gives brightening and also flushing effects. All right, face protocol, if you are using a linear cartridge, we can use 4.5 and also 3.0, followed by 3.0, which is nasolabial line. And for neck and mandibular, we can use 4.5 linear, followed by 3.0 linear. All right. Now for double chin, I normally use 4.5 linear. For brightening and flashing, I always use 2.0, and I use throughout the whole face. Okay, why is Ultracel Q Plus is considered the best HIFU around? Okay, I feel this is the most important slides for the whole presentation. And this is divided into two, the dot cartridge and linear cartridge. So you can see the dot cartridge, the optimal temperature for tissue shrinkage is about 65 degrees Celsius, causes local heating. In return, it causes collagen denaturation, and in return, it causes neocollagenesis. And remember this, dot gives you an excellent lifting and tightening effect. All right. Now coming to linear, the optimal temperature for this fat destruction is 58 degrees Celsius, where it gives you a bulk heating. Remember, it gives a bulk heating. Therefore, it also causes fat melting, and which actually results in volume reduction. So when we are using a linear, what shows more is powerful contouring or reduction in fat. So now you remember, a combination of both the cartridge at the same time of treatment will have lifting, tightening, and also fat reduction. All other HIFUs have lifting and tightening only. However, with linear cartridge around, which has a bulk heating property, it also gives fat reduction. So again, lifting and tightening plus with powerful contouring, which is fat reduction. Now, this is just to show again dot and linear cartridge. After a dot shot, a discrete, discontinuous fibrous septa was formed. You can see here, this is fractional ablation using the dot cartridge. However, in linear cartridge, after a linear shot, long fibrotic septa was formed due to the melted fat around the tissue. All right. And that causes bulk ablation. So you have fractional ablation, you have bulk ablation, so results in tightening, lifting, and fat reduction. Okay, what is so great about 2.0? This is how it works. 2.0 linear cartridge, when we use it, it gives improvement on flushing and also complexion by the bulk heating. So what happens here is when you see 40 degrees Celsius, the red cell flows increases. When it reaches 50 degrees Celsius, the contraction of capillary started, and 70 degrees Celsius, the contraction of capillary increases. So you can see here the treatment, and you can see the contraction of the capillaries has increased, right? So therefore, it improves the flushing by contracting the enlarged capillaries that causes flushing. Okay, then there's another advantage of Ultracel Q Plus when we use it, because the cartridge is very, very slim. Therefore, it helps a better visibility on the spot and gives you a better and convenient treatment. So you can see it is very slim, very, very slim. And therefore, when you visualize, when you do your treatment, there's not much difficulty we are going to encounter. All right, so dedicated to periorbital wrinkles and narrow area of treatment, we have 2.0, which is dot, and features is very sharp and shallow, and there is an adjustable short length, and you can even see where you are treating. So it's very important, because when you go to a narrow area around your eye area and all the stuff, if you're using a bigger cartridge, you can't even see where are you treating. Therefore, it is known as there is no blind spot. Post-treatment care, as usual, we just moisturize the skin very frequently. Certain patients, after the treatment, they might develop a bit of dry skin, which is quite common, but I don't really get much patient complaining of that. But I always instruct them to moisturize skin frequently. Advise them to use sunblock, which is very, very important. And I think it is a normal regime in their skincare. Maintain a healthy diet and lifestyle. So when a patient comes to me and they say they want to lose weight, and or they want to, help me to tighten, and you want to lift and all the stuff, they must take care of their diet and also do exercise. Yeah, if it fails, that means the patient does not really take care of the diet part and also the lifestyle, and exercise regularly. Okay, clinical evidences. Coming to clinical evidences. Okay, this is a patient who came with under eye bag, and also she noticed there's a lot of wrinkles in her eye. So she didn't want any form of fillers, she didn't want any form of thread, she didn't want any form of injectables, so we went for HIFU. So you can see the before the right eye and before the left eye, before and after. All right, you can see the right eye and left eye. So what we used was for the right eye, and since the right eye has got an eye bag, I use more shot on the right side. So we use 3.0 millimeter, and I use the linear cartridge at power of 0.40 joule and 100 shots, and followed by 2.0 millimeter where I use dot cartridge, just a power 0.2, another 100 shot. So total of 200 shots. And for the left eye, I use 3.0 millimeter cartridge of linear, 0.4 joule and 100 shots, and followed by 2.0 millimeter diameter, which is actually a dot cartridge where I use 0.2 joules and I gave about 50 shots. So right side, I gave about 200 shots and left side 150, and you can see the difference. And trust me, there is no injectables used, there's no thread used, and you can see the wrinkles very, very reduced so much that she really appreciated the differences. This is another patient who came with the same complaint. You can see the eye bag, you can see the eye bag, all right? You can see the wrinkles here and also the wrinkles. And what I did was for the right side, we used 3.0 millimeters. We used a linear 0.40 joule and also 100 shots. I use 100 shot. And also 2.0 millimeter followed by 2.0 millimeter of dot cartridge. I use 0.20 joules 100 shot, and total of 200 shot. And the left side, I use 3.0 millimeters, 0.40 joule 100 shots, and 2.0 millimeter dot 0.2 joule 50 shot. I've given 200 shots on the right eye, and on the left eye I've given 150 shot, and you can see the difference. And there was a question whether I did a single, this one, I mean, a single, is it a single session? No, the answer, we did about 3 sessions for each patient. This one. All right. This is patient number 3. And she also, you can see a lot of wrinkles here. And eye bag. And this patient also, we have given about 150 shots on the right side and 150 shots on the left side. And same method, I use 3.0 millimeter of linear cartridge, and always use linear before dot because linear has got more wider coverage. So it goes a bit deeper, it goes much cover, it covers much bigger area, then you go a bit superficial. So we use 3.0 linear followed by 2.0 dot, and I've given 150 shots on the right side and 150 shots on the left side, and this is with her eyes open, and this is with her eyes closed, and you can see so much of difference actually in the wrinkles. It has reduced a lot. Okay, this is another patient under eye, my 4th patient. And again, for her, we have given about 150 shots on the right side and 150 shots on the left side. Again, you can see eye bag, you can see wrinkles, but post-treatment, you can see a very good result. Okay, so we have used 3.0 millimeters linear cartridge, 0.4 joule 100 shots, followed by 2.0 dot cartridge using 0.20 joules 50 shots on each side. And this is with her eyes closed. You can see a very obvious, healthy looking, free wrinkle or reduction in wrinkles so much, and she is a happy patient. Okay, this patient came to us and her problem was sagging. So actually I've recommended her to use a thread. But again, as patient, this patient is not she wasn't interested, or she doesn't want to indulge into any form of invasive procedure. So we asked her to take up HIFU, and we have treated her cheeks, all right, even her double chin, the forehead area, and all the stuff. Yeah, so you can see post-treatment a beautiful, much slimmer face, much protrusion of the chin area without any fillers. You can see the reduction is in nasolabial, both sides. And we have used about 300 shots on the right cheek, left cheek. We have used 300 shots. Double chin, I've used about 150 shots. The forehead, 25 shots on the right side and the left side. And total, we have used about 800 shots for the patient. And again, the cartridge I used for the cheek was 4.5 followed by 3, and double chin 4.5 millimeter. A linear cartridge was used. However, forehead we used 2.0 dot cartridges and total of 800 shots. And this is her result. And you can see a beautiful jawline has been created compared to here. But after the treatment, she developed a bit of papular urticarial rash, which was settled by giving some cetirizine to her. You can see her nasolabial, so much of improvement is seen, and it is really lifted up. Nasolabial, so much improved. And her double chin, you can see much slimmer here. And beautiful jawline. Okay, this is another patient. We have done her full face where I used right cheek and left cheek. We have used 4.5 linear followed by 4.5 dot. So if I'm using a linear and dot, I will always go for linear first, then I will follow by dot. So there will be a fat reduction, and after that there will be lifting and tightening effect. So we have given her about 300 shots on her right cheek, 350 shots on the heavier left side. Double chin, we have used about 150 shots. The forehead, we have used about 25 plus 25, which is 50 shots. And total shot which was given was 850 shots for this patient. And this is beautiful jawline has been drawn here. Her nasolabia was reduced, and you can see the cheek area by using the linear cartridge, there'll be a fat reduction. And this is after 3 sessions. You can see the different earring and also the different clothes she's wearing. Yeah. You can appreciate an improvement of the double chin, jawline, nasolabial, and the cheek fat has reduced. You can see this also. And somehow she has got a better complexion. But we did not really use 2.0 for her, but she has got a better complexion too. Okay. I mean, obviously, very clearly that shown that it is lifted up. Okay, this is our third patient. And same thing, sagging, heavy nasolabial, rounded face, but after treatment, much protrusion of the chin area, less nasolabial, less deep nasolabial, and there's a obvious fat reduction on the cheek area. So what did we do? Again, we used 4.5 millimeter cartridge on linear and followed by 4.5 dot. So on the right side, we gave about 350. On the left side, 350. For double chin, we used 4.5 linear, 0.6 joule, 150 shot. For the forehead, I used 2.0, both sides, 25, 25, and total of 900 shots given. And you can see this more prominent jawline. You can see the cheek area has reduced in fat, and the chin has become more protrusion is there. Double chin has improved. A beautiful jawline is seen. Cheek has reduced in fat, and also you can see much slimmer look. Okay, this is another patient who came with a similar complaint, and I think she's about late 50s, who come complain against sagging and all the stuff and doesn't want any form of invasive treatment. You can see a very heavy cheek, yeah, chubby cheek. You can see a heavy nasolabial line. So we have given her 300 shots on the right cheek, 300 shots on the left cheek. Double chin, I've used about 100, but I've used 6.0 millimeter followed by 4.5. Normally, the recommendation is 4.5, but you can try and error, you know. Once you use it, you get an experience on it and you see a result, then why not? Okay, and remember this, I never ever use numbing cream for my patients. There's no local anesthesia at all. So we have given her 300 on the right side, 300 on the left side, double chin about 100, forehead 25, 25, and total shot was 750. And definitely you can see the fat reduction on the cheek area. You can see much defined line. And here is very obvious. The cheek area has reduced in its reduction. There's cheek reduction. And it's quite obvious. Okay, this is another patient who is a 60 plus. And we have given her about 750 shots. We have used 4.5 millimeter linear cartridge, 0.6 joule, 100 shots, followed by 4.5 millimeters, 0.8 joule, which is using a dot cartridge, 200 shots. Now, if you ask me, or if you observe here, I use more of dot cartridge than linear because she wanted not fat reduction, she wanted more on lifting and tightening. So remember, the linear will give fat reduction, however, the dot will give more on lifting and tightening. So for this patient, I've used more on dot compared to linear. And for her double chin, I've used 100 shots by using a linear cartridge, forehead 25 and 25 shot, total of 750 shots for this patient. And one thing very obvious here is there's a bit of fat reduction. Definitely there's a lifting here. You can see much protrusion of the chin without any fillers given. And you can see much defined jawline compared to this. A very obvious jawline and a very obvious fat reduction. And definitely you can see it has lifted. Okay, this is another patient. And after treatment, I think there's a very obvious improvement in her. So what we did was 4.5 millimeter linear for a cheek, 0.6 joule, 250 shots, followed by 4.5 millimeters, 0.8 joule, 100 shots. Therefore, I gave 350 for the right cheek, and also I gave about 300 on the left cheek. And you can see after the treatment, the nasolabial has reduced. Definitely fat has reduction. This fat has reduction. Nasolabial is less deep. And you can see more slimmer face and also protruding of the chin. And you can see after the treatment, you can even see there's so much of improvement on the forehead where you compare here, there are wrinkles, uneven and all the stuff. But here it has become more tighter. So this patient had about 800 shots altogether. Well-defined jawline. The jewels has become much better. You can see the nasolabial has reduced, the cheek has reduced, and there's an obvious lifting and tightening effect here. And even the double chin has reduced. So you can see this area. You can really appreciate around this area and also the cheek area where it's reduced. This is on the left side, and you can see a beautiful jawline has been drawn. Nasolabial has gone a bit better, and also the cheek has reduced. And you can see much lifted and also tightening of the skin has happened, where this is much heavier compared to the treated area. Okay, so this is one of my last patients, which I'm going to show you guys. So this patient is a young patient, but she has a heavy face and she is more into the category of overweight person. And you can see what we have used is again 4.5 millimeters. We are using a linear cartridge, 4.5 millimeters followed by the dot cartridges. And we have given about 250 shots on the right side and 350 shots on the right side and 300 shots on the left side. You can see this is the heavier side, but after treatment, you can see the nasolabial is almost gone. It is definitely lifted. Cheek has reduced, and you can see the chin has more protrusion now. And you can see this, even the double chin has a reduction. Nasolabial has improved and the cheek has reduced. So always remember, linear cartridge gives an excellent fat reduction. This is very, very obvious of the cheek reduction here compared to here and here. That's why I've given more shots on the right side. Okay, this is the left side area. You can see much defined, a jawline is there. Nasolabial has improved so much, and the fat reduction on the cheek has taken place. You can see the difference again, especially the cheek area has improved so much. So that's about my presentation, and that is the pictures from my patient's improvement while doing Ultracel Q Plus HIFU, which is the fastest in the world. And there are a few questions being asked. 3 sessions. Okay. There is a question being asked, 3 sessions based on how many months. So what I do is, my way of doing is actually every month once. I ask them to get 3 sessions, and then I ask them to do every month once, right? And there are doctors who are doing once in 3 months, but somehow when I do every month once for 3 sessions, I see an excellent result. Okay, same setting, 1 month or 3 months interval. There's one question. I would reduce my setting. I mean, the number of shots I may reduce depending on the day of presentation, because they will have some form of improvement. So you can always reduce the number of shots. Okay, is it instant result? Yeah, most of them I gave you was immediate. I mean, there are few of them who actually immediate result was seen. That means I took the picture pre and post. Okay, so this is that's all about my presentation. And what I would like to summarize is, number 1, HIFU is an excellent machine to use. For what? For tightening and lifting. Everyone knows about that. And why are we using HIFU? Because patients do not want any form of invasive treatment, such as any form of fillers or any form of thread lift. And then when they come to non-invasive treatment, then we have HIFU and also radio frequency. But most of the time, they don't want any form of downtime. And this kind of patient, they want to see an instant result. Therefore, you choose HIFU. But why? Why HIFU and why Ultracel Q Plus? Because Ultracel Q Plus, it has got 2 cartridges. One is linear and one is dot. And remember this, dot cartridges give the conventional lifting and tightening effect. However, the linear cartridge gives the fat reduction. No other HIFU does this, because they don't really have a linear cartridge and they don't have the bulk heating property. So with using an Ultracel Q Plus, then we get 3 results. One is lifting, we get tightening, and we also get fat reduction. So patient will be happy. And I always try to convince patient to take up at least 3 treatment. I space it out 1 month once. Again, there are doctors who does once in 3 months, and they are not wrong, and I'm not wrong, I'm not right, they are not right. We go on experience and we see an excellent result. So after the 3 session, I may ask the patient to take up 1 more session after 6 months to maintain the result and improve it further. Okay, cell spacing, what role we need to reduce in older? I mean, the spacing, like what is given in the protocol. So I don't really reduce in older, but there's a very good question here. As a starting practitioner, can we call every month or better to wait 3 months risk of atrophy? You are excellent, correct. I mean, that's a very good question. That's a very good answer, because we are worried about atrophy, right? Atrophy of the muscle. But you should know why is the patient coming. So again, why is the patient coming? And number two, what is the age of the patient? So age of the patient, if they are older, then we can space them out a bit to reduce the risk of atrophy for sure. And if they are younger, we can go a bit of aggressiveness. And which cartridge do you use for tummy and arms you prefer? Okay, this is not today. Today, this is not our topic. However, I would like to answer this. I normally use cartridge 9, 11, and 13 for the body. So I will start with 9 and 13 and 9, 13 and 9, 11 and 13. So I will start with 13, then I'll go to 11, then I go to 9. And depending on it, how many shots can I give for body? I normally give about 500, 500, and maybe 200 or 500. You can even give about 1,200 to 1,500 shots for the body. Yeah. How to use Ultracel Q Plus under the eye, the movement and placement of cartridge. I use it this way. I hope you all can see my camera. I will go just horizontally place, and I will go downwards. Horizontally place, I'll go downwards, and horizontally place, I'll go downwards, and also I'll go the crow's feet area. So that will give you a fat reduction. You want to reduce the fat. I normally use 3.0, which is a linear cartridge. It may cause some discomfort, then followed by 2.0, which is a dot cartridge, which does the tightening. So normally I will reduce the fat, there's a fat reduction, and later I'll tighten the skin. Any age restricted for HIFU? I mean, you can start any age. I mean, for me, I start even about 25. I'll start. And old age, depending why they are coming to us. So most of the time, old age people, they are more sagging skin. So not for fat reduction, they want for lifting and tightening. So what do I use more? I use the dot cartridge more than the linear cartridge. So it all depends the age. Then what cartridge you want to choose? And what do you want to do? You want to lift it? You want to tightening it? Or do you want to reduce the fat? So younger one, you can use more linear cartridge compared to dot. For older one who is coming mainly for lifting and tightening, then you use the dot cartridge more than linear. Yep. I hope I've answered all. So I think I'm done with my talk.
All right, thank you so much for the presentation, Dr. Rasool. And I would like to thank Dr. Rasool for his presentation this evening. I would also like to thank everyone for attending this evening's event. So if you would like to leave feedback on tonight's event or would like more information on the JCs, just leave a message in the comments section, then we'll promptly reply. Again, thank you everyone and have a good evening. Thank you.
Thank you so much. Thank you.